So now we're going to do the migraine procedure. So once you've done the basic 1, 2 and 3, pages 1, 2 and 3, you can do extra procedures. The migraine is something which a lot of people like receiving, and it's a little bit of a tricky one. There's no rolling moves or anything. You just place in fingers on meridian points mainly. So with this one you don't use your ring fingers, but you use all of the others. So you start off with your middle fingers, and there's a meridian point just in there. There's a little hollow just at the top of the nose, either side, just underneath the eyebrow. There's a little hollow there, and that's the first point. You hold that for a few moments, and then you put your index fingers just above the eyebrows, lift up your middle fingers, and then your thumbs just on the hairline, just for a few moments. And then your little finger goes to the outside of the eyebrows, and then you lift up your thumbs and you repeat. So this is what it'll look like. So this is why it's called a spider, because it does look a little bit like a spider there doing that. So do that for 10, 15 times. It doesn't actually matter how long. And then the second part is you get your thumbs and you go across the forehead and down in front of the ears. So it's just basically relaxing the muscles of the forehead and going down. So do that 2 or 3 times. And the last one is like a teasing of the hair, because people got to have hair to be able to do this. But I suppose if you're a bit bored, you can be just like stimulating the top of the scalp, but it's like teasing around, which is like stimulating the blood supply on the scalp. So you're just going around, try not to pull any out, and I've done this once on somebody that had a wig. Doesn't work so good if they got a wig. So that's just teasing of the hair just to stimulate the scalp. So that's the spider. You can do it for as long as you like. So you can do that movement there. You can just keep going until you feel it's time to go on to the smoothing of the forehead and then a teasing. So when the line of these points, you keep your fingers apart. So they're apart about 1 finger width. So they're not. So when you're going up the forehead there, your fingers aren't touching. They're apart by about 1 finger's width. So if you can see from there, it would look like that, that, and then a little finger just to the outside on the temples there. And that's quite a good way to finish off a treatment. The only thing is, people do love it, so sometimes, you're making a rod for your back, and you'll always have to do that once they've had it once, because they feel so relaxed afterwards. But it's a nice way to finish a treatment. And then you would leave them for a couple of minutes. So you go out of the room, leave them for a couple of minutes, and then come back in and ask them to sit up and ask them if they wanted any water. So that's the key, really. Most people say no, they don't want any water, but probably it'll be a good idea to actually have the water there and give it to them and ask them, so that they will actually take it, because most people will say no from politeness when they actually need some water. Okay, good. Thank you.